Those are the principles. 3 meals a day, 4 ounces per weight, protein type food. If you do those 3 things, you will lose all of your excess weight and you will never gain it back. I guarantee it. You can't, because it would be impossible. There's not enough calories in that amount of food and that type of food for 3 meals a day at that amount to have excess to store as fat. So again, the satiety has been satisfied because we got the smaller stomach, signal goes back to the brain that says you've had enough. Appetite doesn't really matter, because it doesn't matter how big somebody's appetite is. If they're satisfied with a small amount, that's the goal. And metabolism hasn't come into play because there's only a small amount that has come in, and there's not enough for metabolism to cause a problem by storing it as fat. So again, those 3 simple things, 3 meals a day, 4 ounces by weight, protein type food, you'll lose all of your excess weight and you'll never gain it back. Now, in saying that, everybody is smarter than an operation. There's no doubt about that. There's no secret. Anybody can get around an operation. That's where some of this behavior change and working with it comes into play. That's some things that just you have to control. You have to control that. First big problem, snacking. Snacking always starts out innocent. Always. It always starts out as a couple peanuts. But what you got to realize is that the brain is very powerful. The brain can justify almost anything. Just like over time, 20 years ago, food portions were very small. Like you go to McDonald's and get a meal, the fries came in a little bag, right? That's not the case anymore. Fries come in at a minimum in a carton like this big. So, but we've become accustomed to that, and like that's what's normal now. Well, it's not normal, but the same thing can happen with snacking. A couple peanuts isn't going to hurt anybody as far as calories go, but it's a mental thing. It's allowing yourself to have the calories. So what happens over time, because this is for the rest of your life, it's not a 3-month diet, it's the rest of your life. What happens is the brain justifies it, and it's natural, and it's what everybody does, but over time, the couple peanuts turns into a handful of peanuts, and then it's a bag of peanuts, and then the peanuts aren't around, so it's a bag of chips. And what happens over time, the natural progression is that somebody is now eating in between their meals, snacking, to where now they're not eating 3 meals a day anymore. Remember, the meals are fairly small, so if you're snacking, you're probably eating about another meal. So someone's eating 6 or 7 or 8 meals a day as opposed to 3 meals a day. The operations are very effective for helping you to control what you eat at one time, one sitting. The small stomach, you can't eat a large amount of food, but nothing can stop someone from just eating all day and just eating throughout the day. So that's what snacking leads to, is just getting calories in throughout the day. And it all comes down to calories. If you get the calories in, you're going to store it as fat and gain weight. That's just all there is to it. You can't eat 10,000 calories a day and weigh 150 pounds. That's impossible. You can't do that unless you're an Olympic athlete in training, which none of us are. So you got to eat the calories to weigh, let's say, 150 pounds. Men are going to weigh more, and depending on their height and that, but 150 is a nice round number to look at. So those 3 things are what you want to do to eat and to lose the weight and keep it off. The 2 foods that you should avoid, and then everything else is really open to you. It's just that, like I said, there's food choices that are better than others. But the 2 things you want to avoid, one is sugar. And that's because we talked about with bypass, it actually causes a syndrome and dumping, and it's very, uncomfortable. But we want to pretend like that happens in the other ones as well, because sugar just gets stored as fat. So you want to avoid sugar. Sugar substitutes are okay. The more natural ones, like the stevia, are probably better choices, but avoid sugar, processed sugar. The second thing you want to avoid are carbonated beverages. Carbonated beverages, in theory, the carbonation, not the calories, because there are a lot of non-calorie soda pops now, but in theory, that the carbonation can expand the smaller stomach, and over time make it a little larger, which we don't want, because then you would want to eat more. So carbonated beverages are recommended to avoid. We don't really understand what's going on with soda pop, because there are studies that have shown that even with diet soda, which have 0 calories, people still tend to gain weight. So the additives and whatnot that are in the soda pop still have some sort of weight gain potential. So it's better to avoid those 2 things. Outside of that, Again, meats and vegetables are better choices, but 3 meals a day, 4 ounces per meal, protein food, limit the carbohydrates. If you do that, you'll lose all your weight, you'll never gain it back.